now hear in full from the Health Secretary, Steve Barclay, for his reaction to the strike. Have a listen.
Well, I deeply regret these strikes, and in particular the timing, which have been timed deliberately coming straight after Easter. The fact that the BMA junior doctors have asked their members not to tell NHS managers whether they intended to go on strike or not, making contingency planning more difficult, and also their refusal to agree any national exemptions. Other health unions, like the Royal College of Nurses, agreed national exemptions, particularly, for example, for cancer patients, so that those patients weren't impacted. The Junior Doctors Committee has refused any national exemptions, and obviously that puts patients at greater risk. But we're working very hard to mitigate those impacts. I had a call again with NHS England yesterday, looking at the contingency measures in place, and I want to thank people across the NHS, particularly the consultants, the nurses, the many staff who are working today to mitigate the impact of the strikes.
What reassurance can you give to hundreds of thousands of people who are affected by this, who will be very worried about their health? Can you give them a reassurance that you're putting every effort possible into resolving this situation and trying to get around the table and having a talk with the junior doctors?
Well, a huge amount of effort is going in to mitigate the impact of the strikes, to ensure that emergency cover is there. The clear message to the public is for those who need the NHS will be there in terms of responding to urgent calls, but to be mindful of the demands that they place on the NHS. But a huge amount of effort has gone into the contingency plan and the measures in place given the effects of the strikes, but clearly they've been timed to have an impact on patients, and I think that's very regrettable.
Mitigating the impact, what reassurance can you give that every effort is being made to get around the table? Are you going to make the BMA say they just want a credible offer? Are you going to make them that sort of offer, or are we going to resort to ACAS, maybe getting ACAS involved to try and break this deadlock, because people are very concerned that this situation will repeat itself going forward through the year?
Well, the government has shown that it is willing to listen and to engage in meaningful and constructive talks. We had those talks with other health unions, with the Agenda for Change staff. We have a recommendation from the NHS Staff Council to their members based on those meaningful and constructive discussions that we had. We also listened to doctors in terms of pension changes, and the Chancellor announced those pension changes at the budget. So the government has engaged constructively. My door is open, and we remain willing to engage constructively with the junior doctors, but clearly a demand of 35%, which would involve some junior doctors receiving over £20,000 more in terms of their basic pay, is not reasonable to your viewers, to those who have to balance the wider issues of the economy and getting inflation down, alongside recognising the very real pressures that the NHS and junior doctors have been under, not least from the pandemic.
Is the long game here that, as with nurses, obviously they had a lot of public sympathy, you reached a settlement with nurses, is the government's long game here perhaps that public sympathy will run out for the junior doctors? They see the pay demand as perhaps high, and maybe it's just a waiting game for the government and hoping that they'll pay.
Well, we want to reach a fair and reasonable settlement with junior doctors. We recognise the hugely important role that they play within the NHS. That's why we stand ready to have meaningful and constructive talks with them, as we have had with other health unions, as we have in terms of responding at the budget to concerns from doctors regarding their pensions. So we are ready to have discussions with them, but clearly a demand for 35%, over £20,000 for some junior doctors, is not fair or reasonable, and that is why we've not been able to make progress so far. But we want to engage constructively. We recognise junior doctors have been under significant pressure, particularly from the pandemic, and we want to work with them to find a fair and reasonable settlement.
Do you regret? Last one. Just a couple. Do you regret describing them as militant? Is that a word you regret using? Do you think that inflames the situation?
No, I think it's not reasonable to be saying that members should not let their NHS managers know if they're going to go on strike, or to give no national exemptions, in contrast to the behaviour of other health unions. Other health unions agreed national exemptions, recognising the impact on particular patients, such as those with cancer, and I think it's deeply regrettable that the Junior Doctors Committee refused any national exemptions, refused to tell NHS managers so that the contingency plans could be put in place knowing who was going to go on strike. And so that is regrettable, but we want to work constructively to find a fair and reasonable settlement. But clearly a demand for 35%, over 20,000 for some junior doctors, is not reasonable.
The Health Secretary, Stephen Barclay there. Now, the leader of the